And time now on a Friday afternoon for our newsmaker. Infertility is on the rise in our country, apparently. It affects some 7.5 million Americans. It is an important time to talk about infertility because next week is National Infertility Awareness Week. Mindy Berkson is an international fertility consultant and the founder of Lotus Blossom Consulting, and she's our newsmaker. Good to see you today. How are you?
Thank you, Chris. Thanks for having me.
If there's one major point you would like to get across during Infertility Awareness Week, what would it be?
Educate yourself. Be an informed consumer. Be an informed patient. Know what questions to ask your doctor. Know where to find resources for your cycle. Because finding these resources is what really helps you maximize your cycle and minimize the financial expense for it.
Is infertility actually on the rise in our country? Are we seeing more of it than we did, say, in the 70s, 80s, back in the 60s, 50s?
We're definitely seeing more, and the major reason that we're seeing more is delayed childbearing. Women are consciously choosing to have children later in life. And as we age, so do the quality and quantity of our eggs. And so, therefore, it is more difficult to conceive in your 30s.
Now, this is not just a female problem, though. I'm sure you talk to the male part of this equation, too.
I do. Actually, of infertility affects 1 in 6 couples. 40% of that is women factor, 40% male factor, and the remainder a combination of both.
How long should a couple normally wait if they're trying to start a family, they're having difficulty? I mean, it does take a little while. How long should you wait before you actually go and seek some medical attention to the possibility of infertility?
Well, if you're about 33 years old and you've been trying for more than 6 months, I strongly recommend that you go to a reproductive endocrinologist to do the diagnostic screening and testing to determine if there really is an issue. And that's the best place to get a treatment plan for your particular cycle.
What's involved in this type of screening and testing?
Usually it's blood testing, hormone levels, and very often ultrasound testings for women, and obviously sperm testing for men.
And what are just a few of the things that the doctors will recommend and that you can do if you have some fertility problems so you can conceive?
Well, there are a couple treatment options, again, very individual to your specific situation, but egg donor, using a woman between the ages of 21 and 32, certainly increases your chance of success if you are in your later 30s, because the success rates for your cycle will be linked to the age of the egg. So you can dramatically increase your chances of success by using an egg donor.
What about some health style changes? I have to think that if perhaps you're overweight, or the other end of the spectrum, maybe if you're underweight, maybe if you're a smoker, I mean, heavy alcohol user, that has to be part of the problem, right?
All of those can contribute to infertility, and definitely being too underweight can be an issue as well.
Tell me very quickly about Lotus Blossom Consulting.
We are an infertility consultancy, and what we do is help our clients financially, physically, and emotionally to plan for the entire cycle from start to finish.
And that's right here in our valley?
Oh, I'm located physically in Chicago, but I work with clients all over the globe, and I work with clinics and surrogates and egg donors all over the country.
Are you a mother?
I am a mother of 3.
So you know of which you speak. Mindy Berkson, thank you, international fertility consultant, Lotus Blossom Consulting. And by the way, for more information on some numbers you can call for information on any infertility problems, and again, next week, Infertility Awareness Week, go to kpsplocal2.com. We will link you. Mindy, thank you for being with us.
Thank you, Chris.
Have a nice weekend.